An hours-long hearing for a doctor who's suing Sentara just wrapped up. The doctor wants to be able to prescribe ivermectin and other drugs to treat COVID-19 patients. Ivermectin is an anti-parasitic medication that's not approved by the FDA for COVID-19 treatment. Sentara recently banned the use of ivermectin and other drugs for COVID-19 due to a lack of evidence about their safety and efficacy. Investigative reporter Evan Watson is live outside the Norfolk courthouse. And Evan, what can you tell us about this hearing?
Well, a Norfolk judge will take some time to rule on Dr. Paul Marik's request to change Sentara Hospital policy, allowing him to use ivermectin and other alternative COVID-19 treatment drugs that he claims are more effective. About 100 people cheered and rallied for Dr. Marik's preferred treatments and lawsuit today. Marik says it comes down to physician and patient choice, and the doctor should have the right to provide medications based on their expert opinion. However, a group of Sentara physicians, making up a review committee, recently banned the use of ivermectin for COVID-19 patients. They followed the advice of the FDA, CDC, NIH, and other national health organizations, which said in September that the drug could be dangerous for patients. Dr. Marik has never prescribed ivermectin for COVID-19 patients, but he did prescribe other drugs that are now prohibited by Sentara's policy. Dr. Marik, citing mostly international studies, said drugs like ivermectin are safe and effective for COVID-19.
It's the physician who's at the bedside. I'm responsible for the patient. I'm responsible for the patient who's dying, not this faceless committee of people who, quite honestly, have limited experience treating COVID.
Today in court, Sentara countered Dr. Marik's claims by saying a group of physicians went through a rigorous review process before deciding to move ivermectin and other drugs from a do not endorse but allow list to a do not use type of list. The judge says he's not interested in deciding which medical opinion is correct, but he's more interested in deciding whether the hospital is able to make this policy and whether the doctor, in this case Dr. Marik, is able to override it. Dr. Marik is scheduled to return to Sentara Norfolk General Hospital this weekend to work in the general ICU. Unless the judge rules in his favor, he'll be able to promote and tell patients about the treatments, but not prescribe them. Reporting in Norfolk Live, Evan Watson for 13 News Now.